Would you welcome to the May 6th meeting of the City of Boulder's Cannabis Licensing and Advisory Board. Let's go ahead and start with instructions for virtual meeting and rules of decorum.
Perfect, thank you. Good afternoon. The city has engaged with community members to co-create a vision for productive, meaningful, and inclusive civic conversation. This vision supports physical and emotional safety for community members, staff, and board and commission members, as well as democracy for people of all ages, identities, lived experiences, and political perspectives. More about this vision and the project's community engagement process can be found on the link on your screen. The following are examples of rules of decorum found in the Boulder Revised Code and other guidelines that support this vision. These will be upheld during the meeting. All remarks and testimony shall be limited to matters related to city business. No participant shall make threats or use other forms of intimidation against any person. Obscenity, racial epithets, and other speech and behavior that disrupts or otherwise impedes the ability to conduct the meeting are prohibited. Participants are required to sign up to speak using the name they are commonly known by, and individuals must display their whole name before being allowed to speak online. The Q&A function should only be used for technical questions to staff and will not be used for public comment.
Okay, would you like to go ahead and do roll call?
Absolutely. Before I do roll call, we do have one item. Two items actually. Member Green did email us and she will be out due to a family matter today. And Member Christie resigned effective May 1st, and he wanted to let you all know that he wishes you all well. All right. Roll call. Member Foster.
Sorry, present.
Thank you. Vice Chair Keegan.
Present.
Chair Kunzman.
Present.
Member Noble.
Present.
Ex officio Member Thompson.
Present.
Ex officio Member DiCarlo.
Present.
Chair, you have a quorum.
Okay, so let's take a look at the April 1st minutes. Does anyone have any concerns or questions? Go ahead, Adam.
There is a minor typo under item 9. There's a place where it says HEH, and I think it's supposed to be the word the. Everything else looked correct to me.
Good catch, although I'm trying to find it. I guess spell check didn't find that, huh?
Sincere apologies for the typo.
Whoever was writing it was laughing, right?
I don't think it would affect the substance, but it caught my eye.
One thing you could do is you could make a motion to move with a motion to approve with those amendments being made. That occasionally happens with the BLA.
That's a good idea. I would make that motion unless unless there's further discussion.
And Brian seconds Adam's motion to approve the minutes with that amendment.
Any further discussion? Then we have a motion and a second. All in favor, raise your hand. That leaves no one to abstain or oppose.
So unfortunately, it's not recorded on the audio version for raising of hands.
Okay. So do you want yay and nay?
That would suffice.
You want to do a roll? No, we don't need to do a roll call. All in favor?
Yay.
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 Any opposed or abstaining? Okay, thanks.
Perfect, thank you.
Okay, I've got item 2, general public comments for the board. Do we have
So this is now the time for general public comments to the board. If you are here to make general public comment, please raise your hand and you will be admitted as a speaker. I will display a 3-minute timer. Is there anyone that wishes to speak during general public comment? If you're looking to use the raise hand feature, you can go under the more if you don't see the reactions tab to raise hands. Is there anyone for general public comment? Chair Kunzman, I'm not seeing any hands raised.
Okay. Do we have written comments from the cannabis enforcement officer? Or?
No, we do not. Unfortunately, she could not attend today as well. However, she did give me the following information if you're ready to receive.
Sure.
They have, she has done 1 round of compliance checks completed with no issues. Boulder PD did have 3 DUID marijuana arrests, and there is an ongoing joint investigation for allegations made by a member of the public, of which a copy of that is in your packet.
Do we have a place in the agenda where we can address that?
It's
other
an informational piece, so you can do that under your matters.
Okay.
Unless you would like to do something with that.
No, that's a logical place. Does everybody agree? I got a nod and a thumbs up, and 2 nods and a thumbs up. Okay, all right. We'll save that for matters from the chair and members of the board. And excuse me. Policies, any policy suggestions for them? I didn't see any.
No, there were no policy suggestion forms received for May for agenda item number 4.
Okay, then I guess we're ready to go on to the School of Public Health. And I see.
I am letting them in as we speak. One moment.
See, and this is John Salmon. I'm unable to start my video.
I'm working on admitting you now. All right.
Great. Thanks for joining us again. And I did not see any things to go along with your presentation today. Is that correct?
We have a presentation. We have PowerPoint.
I mean, a packet or anything like that.
No, we can point you towards where our materials can be found. We will.
Okay, great.
So if you're set, I'll go ahead and share screen here and we'll get started. So sorry, let me just get the right spot. Let's see, Colin, do you have it? I had it all set up and it's wandered away. Give me a,
I can share it if you don't.
yeah, let's see. Do you have the newest one up?
Yes, I have the shared
Yeah,
document.
why don't you go ahead then? So while we're getting this up, go ahead and say thanks for the opportunity to return and talk with you. I think you may remember that I actually live in Boulder where the wind is howling, as you know, and joined by my colleague, Colleen, a member of our team who's focused on the educational activities. So if we can go on to the next, and what I'm going to do is give you an update and give some focus on the piece we released in the end of March related to policy matters. Next. So just as a reminder, our website and there's access here through the QR code includes all of our reports and documents our activities. So if we go to the next. Our team is substantial. We have a number of activities that we carry out under House Bill 1317, particularly under the so-called research core, the review activities. And previously, as you know, we've released a very large review of the evidence related to high potency marijuana and THC concentrates as requested under the Act. And then also as requested under the Act, and Colleen will be giving the update, a wide variety of education activities. Per the bill, we have a scientific review council that is chaired by Chris Urbina, public health physician and former director of CDPHE. Next. So current activities, they're well documented now in a monthly newsletter and timeline showing our activities that are on the project website. Some of the activities in progress, and part of this is under our broad mandate. We are reaching out to OBGYN and other providers who deal with pregnancy and young children in a continuing medical education event with Children's Hospital. We plan a similar event with psychiatry, probably multiple events to reach out to providers. We have a number of reports in development based on our review mandate. I would highlight a review that's going on covering a substantial body of literature related to cannabis and mental health. We are also planning a review of the pulmonary, the respiratory health consequences, and then the educational campaign activities that we'll come to. We're also, in response to the many weaknesses we found in the literature that we reviewed, we are convening a group actually in Boulder at the end of June to look at research methods related to cannabis to try and bring some standardization. One of the problems in the literature is there's so many ways that people have done their studies, asked about cannabis use, and we don't have the kinds of studies published to now that we really need, and we're looking to the future with this workshop. Next. This is the newsletter and timeline showing the advances, and this is available on our website. Next. This is a description of the workshop that I mentioned to improve the state of the literature. We hope others share our concern, and there's a great deal of interest in this workshop, and our intent is to develop materials that will reach the broad scientific literature and have impact. Next. The continuing medical education event, and again, this is something that we will continue to do throughout the state and the region. Next. And then collaborations with the Department of Psychiatry at Anschutz, which also has a broad network of providers that, and we're working with them to broaden the outreach of our activities. Next. And then, as I mentioned, literature reviews. Our intent with the initial review, a so-called scoping review that mapped what literature there is to update it. And we are updating now the last year's scientific literature. I think perhaps encouragingly, there's more that seems to be relevant to today's marketplace than previously. And right now we're anticipating adding the findings of about 150 new articles to the resource that we have created and that is available on the web. And again, you can find access to it through our website. Next. So I've understood that you wanted to focus in particularly on this report that we wrote on policy approaches. Next, this came out of our mandate under the language of House Bill 2021-1317 to provide recommendations as we see fit and related to potential regulatory steps. We developed this report in part because some feedback concerning our review of the scientific literature was that we did not say much. In part, that was because the literature did not provide a strong and robust foundation for making recommendations with regard to potential policy recommendations. Unfortunately, the literature review just highlighted above all the limitations of the literature in hand, particularly in reference to today's marketplace. Next. And this simply is that reminder about making any recommendations. Next. So this is the report that we worked on. It's entitled Policy Approaches to High Concentration Cannabis and THC Concentrates. And we have several areas that I'll emphasize today. One is that we tried to map those populations that we considered to be particularly potentially at risk. And here we focus on potential harms. We provided, second, a look at the national policy landscape. Third, we look at policy tools that are available, some already in use. And fourth, we describe what are potential options with taking a precautionary approach, given that the scientific evidence is not pointing in particular directions. Next. And just the report's introduction, I'm certainly not going to read this to you, sets out this rationale that in fact we looked at the scientific literature and did not find a robust base of evidence, as I have said. In fact, the work that we're undertaking under House Bill 1317 was, I think, largely motivated by the recognition that the literature did not point to a particular concentration or dose thresholds that might be used in a regulatory framework. Next. So, there are potentially many at-risk populations needing protection, the pregnant woman, the fetus during growth and development, during gestation, during breastfeeding, the early life years, youth and young adults. There's attention to older adults because of underlying conditions, health conditions. Those with pre-existing mental health conditions, chronic diseases, LGBTQ plus populations, and certain racial and ethnic minority populations. And we recognize that that there are other groups that might be of particular concern. And we are in part using this listing, and it will grow as we receive input for thinking about how to develop and target the educational campaign activities. Next. And I think just going to point out that in the report, we both try and cite some of the relevant evidence, and also, as I'll show you in the table, look at the population sizes within these groups in Colorado. So pregnancy and breastfeeding. Next. Youth and young adults, and we can just go through these quickly, Colleen. So older adults, and there are plenty of us, those with pre-existing medical conditions, and then those with underlying chronic diseases, the LGBTQ plus populations, and various subgroups within our population is defined by racial and ethnic minority designations. And then the table that just gives some idea of the scope and size of these populations is included within the report. So we've listed these different groups, obtain population estimates. And I think, when looked at, these are sizable subgroups within our population. For example, we have over 62,000 live births per year, a large group of people who need to understand the potential risks to the fetus during development of exposure. Next. We took a look at the national policy landscape in collaboration with the National Conference of State Legislatures, which does a policy database and does policy mapping. And we asked them to look at state level policies that deal with high concentration cannabis products in some ways. And as you'll see, there were 22 different policies identified that fell into the 4 categories at the bottom of this slide. Those with concentration purchase or possession limits, those limiting THC levels in some way in products purchased for medical use. That was actually 2 states. Those that limit THC by product or category, and those that apply a higher tax rate to high concentration cannabis products. So 22 policies identified. This was as of last fall. Next. And here's just the distribution of those policies across the 4 categories that I just mentioned. And you can see limits by product or category and limits on amount that could be purchased or possessed. Next. And this is we'll just run through these again, patchy across the states. The first category, go ahead. Second, third, which is our 2 states, and then the fourth. So again, some states are implementing regulations of different sorts. Next. And then we, in this report, review potential policy tools, dividing those up into the consumer side, age restrictions, point of sale restrictions, concentration-based taxation, and distributor side policy tools. And again, those are listed here: marketing and advertising restrictions, warning label regulations, concentration caps, and limiting products in one way or another. And then in this report, next, we review each of these and touch on the relevant literature again as background. So I think you can skip through these, Colleen, too. So these are those. Now, coming then to the situation in Colorado, again, I think we've shown that the scientific literature is not definitive in pushing towards such measures as a concentration limit or other particular actions. We, in our writing on this in the report, advise a precautionary approach. That is, if we can't assure safety, the best thing to do is to be precautionary, particularly in protecting those groups at risk. Our Scientific Review Council, which is mandated under the bill, has been particularly emphatic about THC exposure of the fetus during pregnancy and pointed to the more general scientific evidence on consequences. Next. So we turn and recommend that precautionary approaches be followed in the face of insufficient scientific evidence for pointing in particular policy directions one way or the other. And next. And we talk about, if measures are taken, what they should do. And again, a lot of this relates to our emphasis on the at-risk groups, assuring that people understand potential health risks of products that they use, even in the face of uncertainty. And that goes back to, yes, people may use certain products. There may be insufficient information on potential risks and other recommendations that might be considered as the scientific evidence grows. I think next is maybe the last one. Let's see. Yeah, just our last remarks on this, and a lot of what we have found and not found is sort of the basis for the educational campaign activities that Colleen is going to describe. So I don't know whether you want to pause now for discussion of what I've presented to the moment or go on with Colleen. Either works for us.
Let me ask the group here, including the ex officio members.
I would recommend that the presenters can finish, and then we can have a full Q&A of all the evidence.
That's fine.
Jonathan, will this PowerPoint be available to us, or is it
We
available?
can we can certainly make this available. Yeah. We'll get that to Kristen.
Okay, sounds good. Thanks, John. I will jump into updates on the educational campaign portion of this project. John kind of already covered this, but the second big part of what the legislation mandated was taking the findings from the scoping review and then putting them into an educational campaign so we can educate the public about what it learned. Like John said, the evidence was mixed, so maybe not so conclusive. So that's kind of our charge, is taking what's known about high concentration cannabis and putting it into practice, specifically for those target populations that John mentioned of youth, as well as pregnant and parenting people. I'll just give a brief overview of just some highlights of the campaign. Our main long-term goal is to reduce the use of high concentration cannabis among those target populations I just mentioned. And we're aiming to accomplish that through a multimodal communication campaign. So we're going to leverage different channels to reach our audiences in different ways. So things like social media, that's really everyone, but really targeting that youth population. Things like podcasts and traditional media as well. So billboards, radio, TV, we're really trying to hit all of the marks. We're also partnering with other organizations like the University of Northern Colorado, as well as CSU, to expand the reach of our messages across the state. And then lastly, a key point throughout all of this is that we've engaged community members throughout our entire process to really ensure that our activities and our deliverables are aligning with what the communities actually want. So that said, we started this whole process with doing a series of community advisor workshops. And we did those in 3 different locations: San Luis Valley, Pueblo, and Denver. And this is just a snapshot of their main recommendations from that initial round. And that was really to get their input on what messages, how to frame the messages around cannabis use and high concentration cannabis use, as well as where and how to disseminate those messages. So community members really emphasized a need to focus on strengthening youth mental health and highlighting healthy coping skills as an alternative for substance use, because we know that telling someone, especially a youth, not to use drugs isn't the best way to get a message across. So really focusing on that positive psychology side of things. And then on the bottom, you can see that they also recommended sharing those messages through a range of different avenues, kind of like I mentioned before. So things like going out to community events to share the messages, going to pop-up events, we're doing some art exhibitions, motivational interviewing training, so helping people have the tools to have these conversations, as well as social media, like I mentioned before. So we took all of that feedback from the community members and incorporated it into a series of toolkits that we made based on the evidence from the scoping review that John mentioned. We started by creating these first 3 toolkits that focus on the background of cannabis in general, as well as a specific focus on high concentration cannabis. And those toolkits also highlight the physical and mental health impacts that cannabis and high concentration cannabis can have for youth and pregnant people specifically. There's definitely more of a focus for those populations on what we know about any cannabis use and the health impacts for those populations. Less so on the high concentration side, but we do emphasize the point that the general rule of thumb is that as concentrations increase, the harms are likely to increase as well. And then the 4th here, you can see is the motivational interviewing piece that I just mentioned. And that is going to turn into a series of workshops that really equip people to have conversations around this topic of high concentration cannabis. I will mention that these toolkits are not public facing. They're really just serving as the foundation for our other content creation that we're in the process of. Okay, so again, we went back to the community after we took that initial feedback, made toolkits, then we brought those back to community members to say, okay, did we hear you correctly? Are these the type of messages that you want to be hearing? So again, we really want to ensure that the information that we're putting out there to the public is actually going to be received well by our intended audiences. This is just a snapshot of what we discussed in those workshops. So it was things like what pieces of information are most important to them, what do they think is important to know around high concentration cannabis specifically, if anything was missing. And then we also had the focus on positive coping strategies. So what are they actually using in their daily lives to cope with stress instead of turning to cannabis? And then the last piece is what resources do they go to in their community for support, just to make sure we're hitting the mark on that as well. So we took all of that feedback into the toolkits from the community. And like I said, it serves as the foundation for all of the other work that we have going on now. So we shared those toolkits with our partners, which you can see in this table, and they can pull on that content. So we know it's approved, it's scientifically sound, and it's going to be consistent across all of the different projects that we have going on. I'm not going to go into super detail on all of these projects, but I'll kind of highlight what we have happening. The first 3 rows you can see is Initium Health. It's a public health marketing firm who we've partnered with to create the bulk of the content and do the bulk of the dissemination throughout Colorado. So like I said, they're translating that toolkit information on what we know about cannabis and high concentration cannabis into content. So things like videos, infographics, podcasts, social media posts. And they're going to push that information out to communities across Colorado through an integrated advertising campaign. And then they are going to have, like I said, an emphasis on social media to reach those youth populations. I briefly mentioned this before, but we're also putting on 2 art exhibitions here in the Denver area where I'm located. It's just a different way to educate the public and engage our target audiences on the topic rather than maybe a PSA about high concentration cannabis, just a different way to engage people and get them to think critically about the topic. Next, we are going to have a series of trainings on motivational interviewing that's available to community members, which I mentioned. So it's really the concept of asking open-ended questions, reflective listening, so that parents or trusted adults or a peer of someone can engage a friend in a conversation or their child in a conversation about their cannabis use. Could be specifically high concentration, but generally just helping people have that conversation, understand underlying reasons for using it, and maybe assessing their openness or willingness to change. We also have a chatbot in development, and that is going to be housed on our project website. And the chatbot will allow people who are on the website to ask questions related to high concentration cannabis, and then it will match them with answers that were derived directly from our toolkits. And then the last thing I'll call it, as I mentioned earlier, we're also partnering with the other campuses in the School of Public Health to really extend the reach of our messages and specifically target that college-aged population. So throughout all of those projects I just walked through very quickly, we are, of course, implementing evaluation efforts to really understand the true impact of all of those different projects. And we're largely interested in learning about any changes in knowledge around high concentration cannabis, as well as understanding those related behaviors of cannabis use. And we'll hopefully be implementing a long-term follow-up evaluation to see if exposure to our materials changed that knowledge or their behaviors in the long run. And also the follow-up survey will help us kind of understand what worked well out of all those projects I just walked through. What might we want to double down on in the future? What might we want to adjust going forward? So this is my last slide here for you all. I just wanted to highlight again that we're really trying to educate the public about the harms associated with cannabis use and high concentration cannabis use in those target populations, so youth and pregnant people. And we're not only just trying to, we're not trying to scare them, but educate them and also give them tools to use alternative strategies to cope with stress. And then lastly, I'll just emphasize again that we're incorporating community advisors and community input throughout all phases of the project to, again, ensure that our messages are well received and actually useful and making an impact in the long run. So with that, we can open for Q&A. Go ahead, Adam.
Thank you. So I guess one question that I had, and I had a couple of comments, but I did want to pin down this point. In the report and the literature that I've reviewed and the literature that you all are citing, Delta 9 THC is identified as the main psychoactive molecule in both flower and these cannabis concentrates. And I'm not aware of any evidence that somehow the Delta 9 molecule from a concentrate affects the brain differently than a Delta 9 molecule from flower. The issue seems to just be the strength of the product, the concentration of the Delta 9. I mean, I know there's terpenes and minor cannabinoids and other compounds, but it doesn't seem like the Delta 9 is somehow affecting the brain differently from a concentrate, primarily just that there's more of it. And I know that's a unfolding research area, but I just wanted to see if my layperson's understanding is fitting with the study and your review.
Yeah, so I mean, it's a great point. I mean, we've, the language, of course, of HB 1317 is sort of what we live within, and there's not a definition per se of high concentration. And we actually have an infographic. I'm not sure, Colleen, whether you can dig it out real quick. I probably can't, where we've tried to grapple with this, because concentration is only one determinant of what gets to the brain. And so somebody might use a high concentration product, or they might get a substantial, or let's say a dose through edibles or other products. And this is something we have just probably put together, finished off in the last month, because we've struggled with the same challenge. So there's the question that you posed, how much THC reaches your brain. And then we try and go through different products, how they are used, and then have some material there on the amount in the different products, generally around range. So it of course is, you're exactly right. So the critical thing from the point of view of the effect is how much gets to the cannabinoid receptors, and yes, other things may modify a bit, but here we've tried to in fact capture that, and then go along with that, of course, is somebody's use patterns, tolerance, and so on. So that is our effort to put together in one infographic, if you will, an explanation, that addresses your, question we've grappled with from the start of the project. I mean, because there's not, and there probably never will be, a concentration definition, if you will, for what is quote high concentration. That I think, Adam, that gets at your question.
It does, yeah. Thank you, Dr. Samet. Colleen, I guess I had a brief comment. I did want to mention I appreciate the concept that you were sharing that this education would not be sort of a fear-based curriculum, that there would be a focus on well, what causes stress and what are good ways to deal with stress, and who can you talk to when you're feeling stressed, and what are positive ways to deal with stress, anxiety. Tried to get to some of the root causes of teen cannabis use, because back in the 80s, and some folks on the call probably went through the same curriculum, but it was all the DARE program, and it was not a evidence-based education. It was a fear-based indoctrination. And they would present these really extreme, well, if you smoke cannabis, then the next thing you're going to be institutionalized, or you'll go right from cannabis to heroin, or whatever the case may be. I mean, but these are things they literally were telling us back when I was in school. And the problem is, then when you get old enough to try cannabis and none of those things happen, it's really easy to go, well, they just lied to me, right? And just throw all that information out, because you go, well, that's, none of that was true. Like, they just lied to me. But it's tough, because what it didn't give us was sort of a nuanced idea of, what substances do what the trade-offs are, what the harms really look like, and didn't give us any, coping strategies beyond just say no. And in my opinion, that those old fear tactics were counterproductive. I frankly think we would have been better off without being exposed to any of that material, because I feel like it was counterproductive. So I really do appreciate that you're talking about this more nuanced message, and helping teens cope with mental health issues in a more broad way. Thank you.
Yeah,
Yeah.
Colleen, you might stop sharing if you're good.
Oh, okay. Sorry.
Well, actually, I have a question about.
Go ahead.
things
Okay.
like that. So, but Brian has his hand up first. So
Well, why don't you go ahead, Tom, since yours is relevant to what they got on screen.
in follow up to Adam's question, and thanks for the question, Adam, and I appreciate this infographic and your response. Do you think it's? I mean, I'm just wondering. I didn't hear from you whether it's the amount of the milligrams of THC, or is it the concentration? Is like, if you overload a system, then you're more likely to have potential. I'm just making this up right now, but more chance for adverse effects, I guess, if you overload the system, or effects, maybe positive and negative effects. I don't know.
Yeah, so I mean, I think the answer, and I think a lot of the basis for your question is absent from the literature, and we were of course searching for that kind of response. I mean, I think our clinical toxicologists would say that in terms of adverse effects, and let's focus there for the moment, the risk probably simply just goes up with the amount reaching these receptors. Now, if there's tolerance, then more has to get there to make a difference. And there's, to my knowledge, and again, perhaps there's some finer neurosciences going on here in terms of sort of how much has to get there, the degree of receptor activation, what you find with, with functional MRI imaging. I'm not sure that at least we didn't find literature that gets us to the point of particular concentrations, either for adverse or the beneficial effects for which some individuals use cannabis products. And I think, as Colleen alluded to, the underlying message then, in part with the campaign on this campaigns, becomes the more the potentially riskier. And again, that's the big change, of course, in the marketplace is that there are higher concentration products. And of course, flower, again, going back to 60s, 70s with 3 or 4% THC to the current marketplace, which is around 20%, quite different doses of THC are reaching the brain comparing now to then.
Okay, I'll let Brian go, but I'm going to come back. I got more questions about concentration. Thank you.
Yeah, thank you all for the work that you're doing in reviewing this literature and for coming and presenting it and sharing it, the work you're doing both on the research and the outreach with us. My question centers on, I guess, like within the scope of what you've been tasked with, you've been focusing on what we would call like Delta 9 THC, but I wondered in the course of your research, do you have any recommendations or have you encountered any research surrounding other kinds of adjacent compounds like Delta 8, or I think there's these other compounds like HHC and THCO that maybe have similar kinds of effects, but by the letter of the law are regulated in different kinds of ways. And so my high level question is just like, to what effect should the scope of the ways that we think about policymaking and regulation be broadened to encompass these other kinds of, and I'm not a chemist or pharmacologist, like understand this, but like these other kinds of compounds that appear to sort of act in similar kinds of ways, or how should we think about regulating in this kind of way?
So I'll give you I'll warn you, I'm going to give you an unsatisfactory answer, but I mean, we've been focused by what we've been told to do on Delta 9 THC. Recognize, of course, there are many other cannabinoids. I mean, lots of them, I think, is my understanding. So, and in some places, they're certainly becoming, more widely available, and the regulatory approaches probably are far more nascent right now for those agents than for the cannabis and Delta 9 THC. So I think right now from our project, we don't have anything really specific underway. I mean, part of the challenge when we started the literature review, just sticking with cannabis and Delta 9, we had 60,000 articles in our initial screening, and the update for last year was 6,000, and as I mentioned, from the original screening of about 60,000 articles, we identified 452 that met our criteria and from which we extracted information. In the last year, from the 6,000 we have identified 152 from which we'll extract data, which suggests that there's more and more literature become relevant. I'm sure if we began to screen on all the other cannabinoids, that we would probably find a growing literature. Part of our challenge is simply the effort to plow through all these references is enormous. But I'm sure as the product marketplace widens and interest grows in these compounds and their use, reviews like ours will be taken on. Whether we'll be doing it or not, I don't know. But we had to restrict for feasibility.
Sure, I understand. Thank you.
Robin, you all set, right?
I'll let Robin go, and then I got more questions, but I'll share the pie.
Okay, maybe we can go around a little bit because I have a couple as well. But the first thing I want to say is how much I appreciate the work that you guys have done, and I like the emergence of and let me just say, I'm a parent with lived experience of downsides of marijuana use, and what I've come to believe over about 5 years working on this is that a lot of people use these products without any problems at all. And some people use these products with devastating consequences. And so for me, I'm always looking for how do we communicate that message without doing what Adam talked about, but to give people real tools and information so that they can avoid some of these things. I have a niece right now whose son has just had his first episode of psychosis. His father is institutionalized right now for a very serious bipolar disorder with psychosis. And talking to her, I realized how little people understand about that relationship. So I didn't mean to make a speech. I wanted to ask a question, which is, in your group of youth, the target population, do you or have you thought about a subgroup of people who have a genetic predisposition to schizophrenia or other serious mental illnesses? Because there is a real urgency for parents to understand that if your kid has a first episode of psychosis and they have a family history of genetic problems, there is a possibility that those things make each other worse. So that would be my first question. And then I also wanted to know how much money you guys have and how long you'll be working on this. Thank you.
Oh, yeah, so Colleen, I'll take on the second, which is easy, and I'll take on the first as a prelude to you. The answer on funding is, public and available. So this year we actually have $3 million to expend. And that has gone, I mean, these literature reviews are quite expensive in terms of building the team to do that. But this year we are directing about $2 million towards the campaigns that Colleen described. And we await the sort of the legislative direction on where things will go for next year. With your first point, and we certainly understand the concern. I mentioned that we are doing a systematic review on mental health and cannabis use. And in our initial, this broad scoping review, the one area where we did identify enough scientific papers to pursue a full in-depth review was cannabis use and mental health. For example, and I can't remember the count, there are a number of studies on cannabis use in first episode of psychosis, and those will be reviewed. There are, studies on exacerbation of mental health status and cannabis use. There's also a literature on potentially beneficial consequences of cannabis use for those with mental health disorders. So we are systematically reviewing all that. And I guess, I sort of lamented the state of the literature in general. And this is one of those areas where at least there's enough that we are in the process of bringing all the evidence together. And that's a review that we anticipate completing, with a report. I'd hate to, I'll be vague, but it's certainly in a matter of the next months, and not so far out. But Colleen, please.
Yeah, I would, to directly answer your question, we haven't called that out as a specific subgroup, but we are highlighting that throughout our materials. So like I said, in the toolkits, there is specific attention to what are the physical and mental health impacts of high concentration cannabis use for youth and then pregnant people. But in the youth, that's really the main area that the scoping review, like John said, did call out evidence that we can say is different with high concentration cannabis. And in all of our workshops, that is the piece that youth really attach to as well. The fact that if they are predisposed to having schizophrenia or other mental illnesses, that using cannabis or high concentration cannabis could make that worse or make the onset earlier. They really attach to that. So we're looking to highlight that throughout our materials, the videos, the infographics, things like that. And the videos specifically, we're also going for a more like documentary style, like using stories, lived stories from youth in Colorado who have experience with different negative impacts. And that is definitely one of them. So I appreciate the comment and your story. We've heard so many different versions of it. And you're right, so many people don't know about it. So we're definitely looking to pull that piece out.
Thank you so much.
Tom, do you want to go
Yeah,
again?
yeah, Jonathan and Colleen, again, thanks again. I'm just wondering if there was discussion, when you're taking a precautionary approach slide that I wasn't familiar with the wing spread.
Yeah.
I know that's a place in Wisconsin, but I don't know if that's where the conference was held, but
But it must have been, it's certainly named after the place where the conference was held. And this is sort of, enumerated in regard to sort of environmental agents original. I mean, the precautionary principle, of course, is, well known
yeah.
and certainly seemed applicable to us here.
Well, so in the flavor of taking a precautionary approach, I was wondering if you, or especially we in Colorado, should have gone the way of, I know Vermont. I missed the slide. I wanted to see the slide, but it went off the screen so fast. I thought there was a slide that may have different states and different rules.
Yeah, we'll get the report too, and be happy to provide you with the original report from the National Conference on State Legislatures as well.
But the gist of Vermont's law is that nothing greater than 60% is
Right.
allowed. And I wonder if there was ever any discussion about doing that in Colorado, because that's a precautionary approach.
Right. Yeah. And in fact, I mean, we looked at where the 60% came from. And of course, that Vermont can't pin that to any particular paper or study. I mean, again, my understanding of the origins of the work we're doing, came when the folks particularly concerned and, our now representative and pediatrician, Adira Carvalho, was one of those concerned, realized that there just was not going to be the literature that would allow them to anchor a concentration limit. So, I mean, that leads to being, precautionary. I mean, there's certainly products like, solutions in vape pens that deliver higher than 60% on them in the marketplace in Colorado.
So kind of a side or a tangential question is, evidence suggests the human brain is not fully developed until the age of 25. And everything's, we still have these 21 rules, which may not be based in science either.
Right.
So,
Right. Yeah, we had some internal discussion about, in fact, age 25. I mean, the same issue. I've been heavily involved in tobacco and its consequences. And, there is evidence, and we reviewed this multiple times in the Surgeon General's reports, that nicotine affects the adolescent brain in lasting ways. I think the question came up around could a 25-year age limit be implemented for some products, not for others, or whatever. And we did not find any evidence specifically conclusive enough, I guess, to include that in the report.
okay, Brian.
Yeah, thank you, Tom. I appreciate it. It's a nice alley-oop there. Like I was going to ask along the similar lines that our board undertook something like an 18-month process to come up with a set of recommendations to our city council governing social consumption. And as a part of those recommendations, we suggested that we not approve high concentration products to be available in social consumption lounges or hospitality businesses. This issue of whether or not 21 versus 25, we ultimately made a recommendation to council again that like a 25 and up be the limit for a social consumption lounge, much to the chagrin of many other stakeholders in our community. Again, that's not our decision to make as councils. I recognize that, but I wondered that like for us as a board, if you had any themes, topics, priorities that you think that we should be considering as we weigh major policy decisions around social consumption, around reviewing or providing oversight or guidance for other kinds of public health interventions for youth, for to some extent like approving new licenses, inciting and density in all of your researcher coming across these papers, again, recognizing that you were narrowly scoped on concentration, are there things that we should be like weighing or prioritizing around things about licensing, youth use, or other kinds of matters like that?
Boy, that's a broad set of tough questions. I think, without ducking and bobbing too much here, I would say that from the high concern public health wise, I mean, again, going back to what Colleen emphasized, gestation and breastfeeding, critical window, and bringing awareness to those providing healthcare in contact with those who are pregnant or breastfeeding, we think is a critical moment. Now, how that relates to social use, I mean, if you think about how patterns of acceptability of alcohol use during pregnancy changed, I mean, in a way, we need to have the same depth of knowledge reach the public at large, and particularly those who are likely to have children. I think the other concern, I think this does go back to our discussion about the adolescent brain and the fact that substances may have lasting consequences. I think that is an area how you can deal with that. I mean, if you think about what might be restricted in social lounges, that's such a small portion of the opportunity for young people to use high concentration products. And I think that's, where education has to fit in. I mean, I think and how we achieve that broad reach is not, it's something that we are working on. And the way I would see our educational campaigns working, I mean, assuming this is an ongoing activity, the School of Public Health, is that we will continue to direct and redirect as we learn more. And as we learn more, Colleen mentioned evaluation. I mean, I think part of what we need to do is understand if we are getting to the, 15, 16, 17-year-olds, whomever, who may be using a vape pen or dabbing and getting a high dose. So I think we need a multi-pronged approach. I mean, I think our education campaign is part of that. We looking for these ways to try and, broaden our reach. For example, reaching to critical healthcare of those in the healthcare sector who may interact with these particularly high risk individuals. But I think our discussion, your comments highlights the fact that we need to reach sort of everybody, and that's parents, and that's children, that's adolescents, it's young adults, and those high risk groups. And we're trying to do both. And this is our first year of sort of a high volume educational campaign, and we'll learn a lot.
Yeah, thank you so much.
I'm assuming part of the process will be to study the effects of this educational campaign.
Yeah, Colleen, go far away.
Yes, definitely. Not only are we going to have evaluation efforts for the public to use and after their exposure to the materials, but also for our partners, understanding the process, how it went, what went well, things like that. So we're doing all the evaluation. We love the data.
Adam?
Thank you. Yeah, I wanted to comment briefly as we, talk about policy recommendations that this board might consider or that might be considered at the state level. And this isn't intended to be unduly critical of the authors of the report, because I understand you all were given a task by the state legislature, and part of the task was making recommendations, and you followed the the guidance and requirements that the legislature provided. But as we do get into talking about policy potentially, I just want to point out, and I think everyone understands this, that truly we live in a world of trade-offs, and I don't believe that realistically It's just, are people using cannabis or are they sober? It's more that, people feel a certain way and they want to feel different. And, so to some degree it's, are they using cannabis or something else? And so, I would just, and we'll provide a couple articles to this group, and they're probably articles that, Colleen and Dr. Samet that you all have seen, but I'll email them to you also. But,
Sure.
there is some good evidence that, in states with legal cannabis, rates of alcohol abuse can be lower, rates of opiate abuse, benzodiazepine abuse can be lower. And so there is some evidence of people substituting cannabis for substances that really might have worse public health consequences. And my other concern, I guess, generally about restricting access to a legal, regulated, tested product would be pushing people towards the illicit market. And I think part of why the illicit market has really shrunken in Colorado is that folks can get, high quality, regulated, tested products that are inexpensive. So why would you go to the illicit market? And I would also have and I know these aren't the recommendations necessarily of the authors, but I would see a trade-off potentially there, that if the regulated market is not giving consumers the products they want, I'm talking about adults naturally, the products they want at the prices that they think are fair, then more people will start looking at the illicit market, which could have worse health outcomes, or potentially empower cartels. There's it's illicit for a reason. But I know that the authors are aware of those trade-offs. That was
Sure.
something more that I was just pointing out for this board to keep in mind as we talk about policy.
Just a couple of quick comments. I mean, our sort of public health jargon for this would be overall public health impact, taking into account sort of everything. And, this same discussion comes up right now in a pretty hot discussion about electronic cigarettes and public health impact, and whether those smokers who switch gain some health benefits, while the access to these products may, affect youth initiation of nicotine addiction. I mean, I guess the other thing that we'll all watch with interest is what happens with the classification of cannabis by FDA, which, again, we'll see where that goes. It's in Schedule 1, of course, for a long, long time, and we'll see. It seems that there's a move to reconsider that. I can tell you that right now, doing research on cannabis is problematic for those who want to use it experimentally or administer it, because they're left, if they're funded by the National Institutes of Health, with using these experimental cannabis that is available. And I think now the flower was at 3%, and I think it's going up to 6%. And they're working on some model of other ways to use it, but that's certainly been a barrier to doing research that's relevant to the marketplace.
Other questions? Kate, anything from Michigan? And Jacques, you got your hand?
Yeah, I just have a slight question, comment on the aspect of the youth in regards to finding ways to cope with stress. I believe you were talking about. Have you guys taken into account just like social factors and kids just kind of like being kids to rebel, and like finding, like including that as like not just kids, like we're doing this to cope with stress, because I mean it's not the whole story.
Yeah, that's fair. I think there's a host of reasons why somebody might turn to it, especially youth, but also it's not our only population. But within youth specifically, we are focusing on the stress root cause. I think peer pressure is another thing. We are accounting for that in like our chatbot, for example, and other materials of like the motivational interviewing trainings, like what might you say to cut back your use, or what might you say to stop using, or what might you say to someone who offers it to you. So kind of that peer pressure aspect but focusing on the stress more heavily as a root cause for both of our target populations, youth and pregnancy.
One idea I was just thinking of if Boulder City Council actually ever did decide to take up our recommendations on hospitality establishments, and this is like totally magical thinking, decide to go with our recommendations and try the age limitation of 25 rather than 25 or 21, it would be an interesting testing ground. Now, I know, as you said, or both you and Brian kind of said, it's a limited scenario in terms of where people can get their concentrates anywhere. They're not necessarily going to go to a hospitality lounge, but it would be an interesting scenario or interesting research design to compare that versus another community that had hospitality and suites, and what the effect might have been if that limitation went through. I guess I'm trying to intrigue you.
I agree. I mean, these are the kinds of scenarios that we should take advantage of to look at the consequences. And people do, of course, these kinds of analyses very often at the national scale if the data are available.
Okay. Are there any other questions? Okay.
Sorry, Kate, go ahead.
Oh, go ahead, Kate.
No, good. I'm just trying to, absorb all of it, right? I think there's a lot of information here. I think the report itself has a lot of good things. I obviously want to thank you both for coming today to present. And, I obviously, not obviously, but I want to look more at it just because I'm curious. Just want to just appreciate the work that y'all have done, and glad that somebody was put forth to do it, right? And I mean, there's a lot that still needs to be done from a research perspective. And, the caveat with it being Schedule 1 and not being able to do the right research. And now, with the possibility of rescheduling, more research can be done by different organizations with different products. And so, I think there's some potential, growth with the resources that are out there, which is, in my mind, really helpful to think about. I don't think there's anything specifically, I'm interested to see the toolkits and resources as somebody who, knows other mental health providers that are looking for those resources. I know medical providers that are looking for resources to give to people, teachers and parents alike. So, just really excited to see what y'all can put out and what that looks like. I do also think, in terms of the, Robin's point about kind of like resources and real tools with the nuance, right? I keep going back to this idea of yes, the psychosis and schizophrenia, but also this kid that has to use it for seizures or pain, or who is using that and hasn't found anything else. How do you make them feel validated and not feel put out because this new campaign is doing this? And again, not to say that it shouldn't be done, because there are, the nuances on both sides, but making sure that whatever the choices that are made, again, that nuanced approach of it's good for some things and not for others. It's not for your good developing brain, but it's good for this thing that affects your brain that causes seizure, so all the things that go on. So not a question here, just more, this is what I've been reflecting on and kind of thinking about as we're talking. And just really grateful for the conversation, and excited for it to continue, and for us to see y'all again in however long, to talk about it again.
Yeah, it's a lot to balance, a lot of different perspectives. We do have the benefits, including like seizure disorders in there. We emphasize obviously talking to your doctor, and it's only for specific medical conditions, but yeah, it is a lot to balance. There's so many different scenarios, so we're doing our best.
No, well, thank you.
Adam?
I just wanted to ask, and if there's literature we should read or something, because this may not be a quick answer. Anyway, the question basically is, so when we're talking about the way the brain tends to develop between the ages of 21 and 25, and how it's developing and changing, I'm going to make an assumption that if you look at the 4-year period between 21 and 25, the changes are less dramatic than between the ages of 2 and 6, say. So how do you quantify, or is it even possible to quantify how much the brain is changing and developing? And if it's possible to quantify that, then between the ages of 21 and 25, how much is it changing and developing? And I realize that sounds like a simple question that may have a totally not simple answer at all.
Well, I'm gonna say I would have to talk to somebody more knowledgeable than I am, and I suspect Colleen is gonna take the same tact. And we could look at, I mean, I still remember I have when prior position that we had a childhood neuroscientist I worked with, and he would talk about brain development, and he would snap his fingers. And he would say for the newborn, that was 10,000 connections in the brain during that, tiny increment of time. So obviously a lot's going on early and it's got to slow down, but I understand the rationale for your question. I just can't give you an answer. And we'll see if we can do a little homework and help out. And we will, just a couple of other comments. We'll get the slides to you through Kristen. The meeting we're doing on May 15th is available. I mean, if you want to sign up, there'll be a review of basic pharmacology. There'll be discussions of our work. There'll be discussions oriented to pediatric healthcare providers. And you could join that, I think, without difficulty. If you have problems, let me know and we'll make sure you can get involved in that. Again, it's on our website and we'll get the slides to you right away. So you have the QR code for the meeting.
Okay. So yes, as with staff procedure for CLAB, once we do get a presentation at a meeting, that does go in the next month's meeting packet. So you guys won't receive that until June.
Oh,
However, you did say it was available on your website.
available on the website.
Correct.
I looked through the website and I could not easily find it.
Colleen, why
just
don't you
give
put
us-
do you want to put that slide back up and just put
Yeah, I can
you can grab the
also
QR code.
put the link in the chat.
No,
I
I'm sorry,
also,
chat can only be used. I'm sorry, chat can only be used for technical issues. It can't go out as a group chat.
So we will,
Sorry.
we'll have the QR code up and you
If you
can
have,
grab.
if you
Great.
have,
I would just wanted to say, Chair, that in this month's packet, there are 3 links under, at the very end, and that one is to the website, one is to the presentation, not exactly this presentation, but you guys' presentation on the communications that you're doing, and the third is to that May 15th event.
oh, okay, I see that.
Members,
Okay.
you have those 3 links.
I see that. Right, am I mute? No, I'm not mute, okay. Found it.
Okay.
Is there an in-person and virtual?
Yeah, we're doing it in person and but you can register virtually.
Okay. All right, any other questions? Okay, well, a collective thank you again. And we look forward to continue working with you.
Okay, great.
Thank you.
Thanks for the opportunity to speak with you.
Thank you.
Thank
Thanks.
you.
Bye all.
Okay, so somewhere I have the agenda. Matters from the city attorney.
Good afternoon, everyone. Nothing from your city attorney.
Okay. Regulatory licensing office.
Certainly. As per requests from the board, you have both the link for the sales tax revenue report webpage for the city and the list of currently licensed cannabis businesses. As to recruitment, we did not receive any applications during this last recruitment cycle that ended in April 19th. There was not a planned mid-year recruitment at this time. However, now that we have 2 vacancies with Member Christie's resignation, I have circled back with board recruitment staff and waiting to hear back if anything else can be done during this time. So with that in mind, it is really important with us having such a smaller board that we do have attendance for quorums. So if you know you're not going to be available for a board meeting, that you let me know as soon as possible in case we need to make alternate arrangements, please.
So in light of that, or in the spirit of that, I'm out of the country the next meeting. And it's going to be hard for me to get on.
So that would leave us with Member Noble, Member Keegan, and Member Foster. So that is not a quorum.
But maybe Member Green.
Well, maybe Member Green. That is true. That is true. Apologies. I was looking at my screen.
Yeah.
So yeah, if we can get that figured out. If you would just send me an email reminder, Chair Kunzman, that would be great.
Yeah. What are the, so 2 board seats are supposed to be for industry members. What are the
No, Member Foster is an industry member.
Right. No, I mean, yes, Member Foster, and then there's a vacant seat for the other.
So we have an at-large and another. I'd have to look. I'm sorry, I don't have that report pulled up, but I know it's because Member Christie was an at-large, and I believe it's one more.
I think you have that right. I think it's an industry seat is open and
Yeah.
at-large seat is open. I think you have that right.
Right.
Well, I was asked a question, and I don't know the answer to the question. I guess I could have them ask you, but
Okay.
We're not supposed to name names, according to 2 lawyers ago. But there was a certain establishment in Boulder that hoped to be the first cannabis lounge. Probably will not be at this point in time. But would a potential cannabis lounge be an industry representative, or could they be an industry representative?
I'm going to leave that answer to our city attorney's office, Mr. Ramirez.
I just wanted to get him out of, I wanted to see his shining face.
Thanks. Okay, so it is an individual that at this time does not own a cannabis license or business.
And so these would be retail, or for the most part, retail and medical, or grows.
Yeah, no, I mean, if they do not own a license or actually, I'm going to double check, but I will get you the answer this week.
Okay. And then again, even if they live in the city of Boulder, but their business is registered elsewhere, that does not qualify them. That's best you know.
Find out.
Okay. All right. Thank you. Okay.
Just a quick.
Oh,
sorry, just for Kristen, you had one more item. I just want to make sure you didn't skip over and just like
Oh,
getting
no,
board
I was
members
gonna get
early.
there.
Sorry. Okay, go ahead.
The last item from matters from the regulatory license office is future meeting agenda items you would like for me to record. Is there anything you would like to add to the existing list? I know we had some items for June that were in the works, but Member Noble.
I just wondered, and I don't, this doesn't feel imminent, or high level of urgency necessarily for our board, but Adam mentioned a couple of things around the impact of, I think what you were saying, Adam, correct me if I'm wrong, please, but that cannabis has had a positive impact on opioid addiction, I think, in places. and also on the illicit market. And forgive me because I only have a very lay understanding, but I understood that Colorado had more opioid deaths last year than ever before. And I also read a couple articles around cartel activity. Again, very lay perspective, but if you wanted to bring more information on that, to the degree the board thought there was anything actionable we could do, I would be interested in learning more.
Yeah, thanks so much. And I did email to Kristen a couple of links that I'd like to include in the new packet, and one of the studies does talk about opioid use, and I've come across a couple other ones, and I'll see within the next few days if I could grab a couple more, because they fill in some different pieces, but I do have at least one link that I want to attach that should speak to that question for the next meeting.
All right, Jacques?
Yeah, one thing in the increase in opioid deaths is more related to the fentanyl epidemic taking over. Because if you look at when cannabis was first legalized in Colorado, opioid use dropped drastically. I don't have the graph. I'm sure I could find it if I looked for it, but there is a graph of that. And then I'm sure that's gone up with the increase in fentanyl usage. And then in regards to the cartel actually can get precursor chemicals from China. There's different manufacturers in China that will send that to the cartel, so it's easier for them to get access to. I've seen a couple different articles on this, and I think the cartel is really more involved in producing the fentanyl and then distributing that, instead of getting pills like from pharmaceuticals. So I think there's a little bit of a difference in the opiates.
Thank you, Jock. And I don't mean to suggest that cannabis is causing either of these two problems to be worse. I just heard Adam talk about the potential benefits, and I just wondered if there was something more there. Thank you.
Certainly. And as that, the deadline for packet materials is Monday, May 20th for the June packet.
Okay. And Brian, do you have any questions about the list created?
Oh, I just wanted to bring something up, and I don't mean to step on staff's toes, but I think that
you're
staff
fine.
had just expressed a concern that we just want to make sure that we get folks here into the meeting on time to give staff enough time to get everyone set up and the configurations right, so we can start on time, since it's a non-trivial kind of just technical task of just getting names and panels and all that kind of stuff set up. So just on behalf of staff, I apologize if I'm stepping over something you intended to say, or you want to say it differently, that
You're fine.
please show up early for meetings, so that we can staff can get everything set up and we can start on time.
Yes, so there's multiple steps. It's not just like we flip a switch. There's multiple steps that we have to do for renaming, promoting to panelist, giving permissions, and that does take time, especially when it's just one of us staff members that's running the meeting. If you could make sure that you're in the meeting room, even 5 minutes earlier, that would really help staff out. And so we're not a scramble, because these meetings do start at 3.
Is 2:55 a good kind of rule of thumb?
Yeah.
Great. Okay.
That also gives you a chance, in case your Zoom does what mine did the other day for a separate meeting and decides to update right as you're trying to log in. So it does give you a little bit of wiggle room there. Thank you, Vice Chair Keegan. Does the board have anything else for licensing?
Well, did we want to address any more of the items on the list or add to the list?
Oh, I'm sorry. People had stopped raising their hands, so.
What was the idea for the cannabis?
Oh, sure, yeah. I was going to bring up, but so in my Matters from Members, I had brought up these 2 links to a Daily Camera article and a Westward article, both referencing the Cannabis Club. at CU. So they've hosted job fairs and they do other kinds of events on campus. So I would like to invite representatives from the Cannabis to come speak to our board, either on the kinds of efforts that they are doing on campus, as well as their experiences as young people around cannabis and space. I think would all be really valuable insights for our board. So TLDR, we invite the Cannabis for future meeting.
Okay. Do you have an idea of what that scheduling might look like, Vice Chair Keegan, as Sunday or is graduation?
I imagine it probably won't be until the fall. So I'd say September, October. And I will back channel with
Okay.
them and find out who their new leadership is, since I think the founding members are graduating here on Friday or Sunday.
Perfect. Yeah, if you could just get me that information, I'll just make a note on the list, fall 2024.
Thank you, Tom.
When's the last time we had Cinnamon Bidwell? How long?
Probably been a year or more, yeah.
Because she's working on a number of new projects, which are kind of interesting, including a breathalyzer test for THC. That's far from, still being researched. So,
I mean, is this a good moment just to talk about, since we're in May and looking into the summer, about folks' availability? Do we want to skip a meeting in June, July, and or August? Just recognizing it's the summer and people are at a different tempo. So both on the topic of like future meetings, also maybe future not meetings. Is there a month or a meeting we'd like to skip and give staff that time back? Well,
So the June meeting is going to be the 3rd of June. July meeting would be the Monday, July 1st. That is a holiday week, the holiday being on the 4th. And then, of course, August would just be Monday, August 5th,
okay.
just for reference.
Yeah, I was gonna say, I was looking at the calendar earlier today, and I won't be able to make the July meeting. Not that I'm, obviously a board member, but just to say that, like, I think, if we were gonna pick one, seems like that one probably would be a good one for all folks. But I just wanted to put it out there.
Robin?
I'm in the same boat as Kate. I will not make July.
Me three. I have a clash with the July meeting, so I do think maybe that would be a good one to either skip or reschedule if possible.
all right. Hearing all that, I would recommend we skip the July meeting. Is there a motion, or is that just a sense of the board?
I would so move.
I don't know if we need to. Do we need to have a motion, Roberto? Get him off camera again.
No, sir, no motion needed.
Oh, awesome. You also gave like the quickest presentation ever, which I truly respect. When you had the city attorney's portion, that was right on.
Okay. In that case, let's go on officially to the last item on the agenda. Brian, did you want to do some other things first, or you want to go and?
Oh, so I think it maybe just like builds on items for future meetings. So that I think a topic for a future meeting, again, not knowing the exact scheduling for this, would just be recognizing that on April 30th, the DEA did release guidance indicating they're going to reschedule at a federal level marijuana, as they define it, from Schedule 1 to potentially Schedule 3. And that might have some little or no implications for the regulated businesses and industries that our board oversees. And so I just wanted to include some future materials in a future reading packet, potentially set up a time for us as a board to discuss, as like there's more clarity around this policy change, what and where this is going to show up for our regulated folks. And so I would just welcome feedback from the board about, in the context of a discussion about DEA rescheduling marijuana as they define it to Schedule 3 from Schedule 1, like what would be other stakeholders, or a conversation that would be helpful for us as a board for our city council and for our community to sort of grapple with this pretty significant change. I guess my question is like, what questions do you have, or what would be helpful for us to scaffold a discussion around on this matter? Who should we be talking to?
What's the timeline if it goes forward?
I think that this is just in this kind of public comment phase again at like a federal level before the DEA makes a formal determination or recommendation to change that. Again, I haven't read this that closely, but for the June packet, I'll include materials as best as I can find. I know that there's a Congressional Research Service memo that just came out June 30th that I found really helpful. I was really focused on the legal aspects, but I think on the regulation compliance pieces, I would like welcome ideas about what else we could include that might change this. I know 280Es can be a huge thing for a lot of folks, but I would welcome other ideas about like how we could scaffold the discussion around the rescheduling.
Go ahead, Adam.
Thanks. So the biggest impact, assuming this gets done and is finalized, would be on 280E, and essentially what that would mean is on the store side that cannabis stores would be able to take the normal and customary business deductions of other retail businesses, which are currently denied to them because cannabis or because marijuana is a Schedule 1 controlled substance. So the big practical effect is tax relief. At the state and local level, to me, there's not, and that doesn't mean that we wouldn't want to recommend anything, but there's no change that's so obvious that I'd go, okay, well, we have to deal with, this new change as part of CLAB. The immediate effect's going to be tax relief, which will be good for the industry. My understanding, I think this is accurate, is I believe the DEA did follow the recommendation to reschedule to Schedule 3, but that now we go into this notice and comment period where they publish in the Federal Register a proposed rule that would be the rescheduling rule. Members of the public get to comment pro and con, and then they publish a final rule. And I don't know the exact time frame, but that'll take a few months at least. So I believe we may see that rescheduling be finalized this year, but it's going to take a few months. It could totally go off the rails and not happen, but at this point, it seems very likely that it will get approved.
I have a question, and
Go
you
ahead.
might be able to answer it, Adam. So it's a rulemaking. It's not, there's not a congressional action that has to take place for the rescheduling?
Yeah, that is right in this instance. Now, Congress would have the power to obviously pass a new law to deschedule it entirely. But in terms of this process, that's spot on. This is an administrative rulemaking process that's happening at the agency level.
Has anyone had any interactions with, there's a regional DEA offices in Centennial. Has anybody had any reason to have any interaction with them? I can reach out and see if they happen to have a local expert that would have any information that might be helpful to us at some point in time. How's that sound?
Jade has her hand up.
Oh, go ahead, Kate.
Yeah, well, I don't want to stop the flow. I mean, I think that reaching out to them would be great to see if they have anything that they'd be willing to discuss. I mean, there's a lot out there about the different way, like the timing on this and what's going to happen. And obviously it's not overnight, so nothing changes immediately, and it's going to take time. And then there's probably going to be litigation on both sides. So there's going to be a lot of that. I think there's, Vicente Cedarberg or Vicente LLC did a great webinar last Friday, kind of going over a bunch of the components of it and what it does and doesn't change and what it's going to look like and what it could look like and what could possibly happen. And there's just a lot bouncing around. If I do get that that recording, I'll be happy to share it with the board if I get it, because I did listen to it and I watched it, and they do a great job of kind of balancing expectations because they have multiple levels of clients. So, happy to provide that too. But to Brian's question, I think that, like, there's definitely a need for us to educate ourselves to a certain degree, but we also have to be, kind of cautious about what materials we're looking at. And I don't think that this board is ready to have a conversation, right, on what the impacts could be. I think that it's about finding good resources at this point and sharing it and then continuing the conversation. So I would encourage everybody to kind of look out, like do some research over the next couple of weeks. And if they find something that was valuable to them or provided a good perspective, to share it in terms of, for the next packet, next meeting packet for June. But I would obviously be pretty selective about what you choose because there's a lot out there. But I plan on definitely finding something to share, and hopefully I can get the video link for the Vicente one. Usually they put that on their website, but I would be
it's up
happy
on
to
their
share
website,
that.
Kate.
It already is from Friday.
Yeah.
Okay.
The Friday,
Yeah.
May 3rd. Yeah.
Yeah, I mean, I thought that was they did a great job. So they do some great updates on new rules and regulations. So anyway, yeah, that's, just that I think we should continue the conversation and maybe to put it on the list of topics for the future and just put rescheduling or federal legislation, and then rescheduling on that as a topic, an ongoing topic that we need to kind of reflect on or touch base on. Would be my
Thanks, Kate.
I guess I was just thinking of getting on their radar. Go ahead, Brian.
Yeah, thanks. I just going to move on to a new topic, so I didn't want to shift our thread if other folks had other things they wanted to say. The other topic I just wanted to add, and this is just a question to staff, I'd already sort of raised it to them, is that just making sure that we could like update the description of CLAB on the city website, and just wanted to ask if there's any updates or input that we could provide. A lot of the way that the CLAB is described on the city website uses future tenses when we've been working for 4 years. So just wanted to make sure that the staff has done a great job keeping the membership up to date, but I just want to make sure that the reflection of all the other kinds of work is updated as well. And if there's any input or advice we could give on that.
Thank you, Brian. So for the city website, anything that we put up there has to be approved by our communications department as well. So if you have some proposed drafts that you would like to send over for everybody to look at, we could include that in a packet. And then if you guys narrow it down to one, we would be happy to present that to our communications department because they do have final approval.
But they don't ordinarily write the script. They take information from others and then.
So when we want to put something up on the web, unless it's like an official like emergency statement or an official statement, that usually comes from staff as, can you please review this and to see if this is acceptable, and they'll go ahead and review it and make changes or omissions or, package it per the Boulder communications department requirements. But we would happy to put something in front of them if CLAB comes up with something.
Okay.
Also, we are currently undergoing our the website accessibility project due to the legislation that requires the website updates for accessibility that comes in July. So staff are doing a lot behind the scenes working on websites. So if you're going to do something, now would probably be the time.
Thank you.
Mm-hmm.
Okay, so let's talk about this letter or this email. Anna is in the room, but she chose not to
Correct.
speak during public comment. So sorry, Anna, if you were hoping to talk now, it's unless the board decides that they want to get some input from Anna. Hopefully everybody's read it. It describes a tragedy kind of for a 15-year-old. And I'll admit that I've had conversations with Anna, and then yesterday Anna and 3 other concerned parents parents met virtually with the mayor, Aaron, and I was invited to join that meeting. And so there's some discussion occurring at another level, I guess. But does everybody have a gist of what the letter describes? I mean, basically, not just this person's teen, but the report is that many teens have easy access to THC, to concentrates. You might have seen the photo, which was all confiscated from underneath the teenager's bed, and so I guess I wish our cannabis enforcement officer was here, because I just wonder when reports are made. I mean, I guess one problem is the root is not a dispensary.
That is correct. The route has a City of Boulder and a State of Colorado tobacco retailer license.
Mhm.
Well, for the City of Boulder, it's a tobacco ESD retailer license, ESD being electronic smoking device. But I can, per her comments that she provided to me, and information that I do know, that there are ongoing joint investigations for the allegations, and there has been.
Okay, and would the same be true for any parent of a child or adolescent?
Correct. If they bring it to us, either to our cannabis enforcement officer directly, or to city licensing, we then pass that on, and then it works its way up.
And what if let's just say hypothetically, if the investigation finds something was done wrong, what's the outcome of that?
So for both tobacco and our marijuana businesses, there are penalty guidelines and penalty schedules that range from fines to fines and suspensions, all the way clear up into revocation, if warranted, but that revocation is a lengthy process.
And then one of the parents yesterday said, and I didn't get a chance to look this up in the past 24 hours, but Delta 8 THC is not allowed in Colorado.
So there are some things going on regarding the Delta 8, yes, and Pam can elaborate a little bit more than that. When we get reports of that, we pass that on to her.
Okay.
But I do know that she's made contact with retailers about getting that off their shelves immediately. Mhm.
Yeah, so it can be manufactured here but shipped to other states. I don't know if Adam or Kate or maybe even Jacques knows about that, but not sold here. Is that right?
That's about as far as I know.
Yeah, I think that's right. It's a problem though, because it's readily available over the internet. So, and unfortunately, and I've never bought any Delta 8 products, but I think with some of these websites, it's kind of like, it just says, "Are you over 21?" You click yes, and then you can buy whatever you want on there. So it's unfortunate. But yeah, that's my understanding, is that Delta 8 is not currently supposed to be sold within Colorado.
And Robin, do you have any insight? Because there's a group of parents that you're probably aware of.
Yeah, absolutely. I mean, I just really appreciate that Anna took the time to write this letter and get into such specific detail about some of the things that these families and schools are struggling with, because I hear about it a lot. And I think that often many others who have different perspectives are not necessarily understanding the depth of some of these problems. And I appreciate this board taking a look at the letter and thinking about these from a multi-dimensional place, because this isn't all parenting problems. This isn't all, what's available on the internet or through a head shop or, secondary sales from dispensaries, because believe me, that does happen. But there are major issues, and I think they're hard, and we have to talk about them. And I really hope that the Boulder Police Department in their investigation, and I hope Pam will follow up with us next time because I was hoping she would be here. Some of the shops that are mentioned here are things that I know parents have been begging for help with for a while. So we really have to get some answers, because if we don't, it's like, what's the point? I'm happy if anybody wanted to ask Anna questions right now, she's on. I'm happy. I don't know if we'd have to take a vote on that. I thought she'd be able to answer questions, Tom, because I feel like we've done that before with people, but maybe there was a nuance to the rule
No.
that I don't understand.
Well, we can ask Roberto, but I think well, go ahead, Kate.
No, go ahead, finish the conversation.
If Roberto, in the past, yes, we have allowed people to speak at times other than the official public comment.
You can certainly do so, but it would be for public comment, not for allowing questions of the board to the individual wanting to speak.
In other words, she could make a statement of some sort if she wants to, but
Right. If you so desire to reopen the portion of public comment, you may do so.
okay.
You just cannot engage.
Kate, you were gonna say something?
Well, I mean, can we finish this topic and then I can?
Sure.
Yeah.
It wasn't about that.
So for me, the question that comes up for me is, we get a letter like this from a family that's having experience with cannabis in this community. What does the CLAB do? What's our response to this? What's the next step on something like this? Because I feel like people don't know where to necessarily go to get solutions. I mean, there might be an investigation by the Boulder Police Department, but I went to a meeting about 7 or 8 months ago where Rob Anderson, who's he's the superintendent of Boulder Valley School District, said that cannabis has become a nightmare in school. That's something he said. So I just feel like we're not necessarily engaging on a level of providing solutions in a really direct way. And I understand these are hard issues. But this is happening in the community. And to the degree that you all can see that, acknowledge it, I think it's maybe leads us to a better place.
Is this about Kate and Brian? Is this about that or a different?
Yeah,
topic?
no, I was gonna, I thought we were talking about whether or not we were gonna open public comment, and I didn't want to interrupt that process. So
Okay.
that's why I decided not to comment, but I do have a comment about this.
Robin, do you know if Anna wants to have 3 minutes?
I don't know.
Oh, okay. Brian, did you?
Well,
Go ahead, Kate.
Go for it.
what I was going to say was, I think to Robin's point, I mean, like, this is something that I think we are, as a board, our job is not just to, I think it's to advise, right? It's to advise not just on policy even, but on what could be done, right? And in terms of a response to this, we can't choose how the investigation goes, but we can ask what's going to happen. We can ask, Boulder, what is going to be done and what they're going to do. And we can kind of ask them to provide us with an update. I think that, when we talk about like, what can we do from local schools and like all, I think the hardest thing, and this is what we were talking about when Allison was on the board, is we aren't responsible for the education, and we can't be, and so it's like, how do we get the right tools to different organizations, or how do we get people, to focus on that, or how can we, what kind of policies can help to impact that? I mean, again, it's beyond sometimes the scope of what we have control over. Our things are kind of security within the dispensary, security in the product, and making sure that the licensees can control what they can control. And this is beyond, I think, a step beyond that. I think there is the enforcement piece from a city perspective. And I think that's where we need Officer Dignac to be here to kind of have that conversation a little bit. And so I do think that saying like, hey, in June's meeting, can we have a conversation about this? Like when you receive something like this, what is the process? What can you share with us? And I think, I struggle with kind of, to your point, Robin, like, what do we do? As a board, we are the ones that need to not just draw attention, but also to like say this is obviously an issue, and it's not just in Colorado. It's all over, that I think it's trying to figure out how the policy can be and the education can balance each other, right? Because I think they're moving into different paces. And that's kind of just how these things work, and also the nuance of where cannabis is. So I think that we need to do something. And so from my perspective, I think, yes, we need to have a conversation with Officer Gignac to understand what happens after you receive something like this. And then maybe we have another conversation about what is it that we could do, from a, advisory perspective. But I do think that there is something about, like, we do need to understand what we can control from a licensee aspect. What can the businesses do? And then there is a separate part of that, right? What can the city do? And I think we can also kind of help to influence both, just knowing that they are separate things, and we only can create what we can create, without kind of the help of Boulder Public Health and Colorado Public Health, and getting that information from them.
Go ahead, Brian.
Yeah, so I sympathize deeply with Ms. Seger's letter here, the kinds of challenges and the loopholes that she's confronting with trying to support her family. And so my question perhaps to the city attorney's office and maybe the licensing staff would be, like, if it is such common knowledge that there are licensees out there, maybe not cannabis licensees, but other kinds of licensed businesses in the city of Boulder that have these allegations against them. Like, what is the best way that the community can go about creating, documenting these allegations, reporting them to city staff for investigations? Like, what is like the best way to document these allegations so that they can create a paper trail that can lead to investigations and hopefully accountability and improvements?
And if I can add to that question, I was just trying to think of an analogy, and I'm not sure it's a good analogy, but what the heck? If we were the Parks Board or the Transportation Board or the, what are they ever, historic preservation or whatever they call that, and somebody had concerns, they'd have a go-to, right? And this seems even more imminent than some of those that I just mentioned. Do we have an obvious go-to for concerned community members?
Yeah, so it would be through our law enforcement officer, but they certainly do not have to go through you. They can go directly to the police department, and anytime a report or anytime a complaint is made, a report is generated. And those reports are often reviewed, and I don't know if it's monthly or quarterly, to see if there are trends in what areas. But the moment that there is probable cause to believe that a crime or any sort of violation that would lead to a citation is before the Boulder Police Department, then they would be doing the investigation. We might not know about it because oftentimes they will work with the state or other agencies in their investigations, and they will not disclose it until they are in a place where they can make those disclosures. But to answer the very specific question, go to law enforcement. Anytime the community has an issue, if they come to us, great. We have a law enforcement liaison, but they can certainly go directly to the law enforcement agency.
Well, as you can tell from the letter, Ms. Segura did that and did not feel like enough action was taken. And so actually in the conversation with Aaron yesterday, Aaron was going to check in with the police chief and check the status of things. But I mean, it seems like teens are pretty smart. I was pretty smart when I was a teen, so they figure out a way around these things, and I guess they are. They're somewhat creative, I guess it seems, but it's not to their advantage, their long run advantage. Go ahead, Adam.
Yeah, I was just gonna say I was, certainly very sympathetic to Miss Seeger and what her family's going through, and I think it was totally appropriate that she reported this stuff to law enforcement. I think it was good that they did that, and I trust and hope that the police are doing an investigation. I personally, I'm a little skeptical about the idea that the dispensary is selling directly to children. I'd be awfully surprised if they were doing that, just because the consequences can be so high. My guess is that more likely there's someone who's 18 and has a medical card, or someone who's 21 who is buying for the kids. But again, I don't know any of that for a fact, and I think it's certainly very appropriate that law enforcement look into it. And again, I would express a lot of sympathy to Miss Seeger and what her family's going through.
The letter speaks for itself, but it sounds, and we heard from 4 parents yesterday, and one of them, I can't remember exactly which parent it was, but their adolescent started doing concentrates. They were introduced at wrestling practice or something like that, and it wasn't even known to the parents at the time. That was supposedly a safe, or you would have expected things to be fine. Your adolescent wasn't going to. They were going to focus on the task at hand, but not be introduced to a drug, which then caused cannabis induced psychosis in that person. And that's one thing that I found alarming, that we have a whole list of new terms that even med students from 10 years ago didn't have to know, like cannabinoid hyperemesis syndrome, as Robin has talked to us about, or this cannabis-induced psychosis. That's not a term I learned in med school, or even med schools where they might still not be teaching it. So I don't know. I'm trying to get ahead of the game, so to speak. But Robin?
Thank you. I just want to say that as a parent who, went through a really extreme downside experience of having a child who became reliant on using these drugs, I know it's like horrifying. It's like watching an accident happen in slow motion, trying to tell people what's happening, what your experience is, and trying to get some attention on it. And that's why I really appreciate the sharing of this letter and what Anna shared with us, because the more people understand that for some users, this drug can be incredibly harmful. And of course, cannabis hyperemesis syndrome for a year was horrific for my kid, but cannabis-induced psychosis that then potentially turns into something long-term that's just a whole other beast. And there are people struggling with these very serious problems. And this isn't about being upset that your kid is using drugs once in a while. This is different. This is a different level. And to the degree that you all have been so gracious and courteous in thinking about this, I just want to express my appreciation. And I think we have to continue talking about these things and being aware of them, because this is happening right in our community. And again, when the superintendent says in a public meeting that marijuana has become a nightmare in the schools, that's something we have to talk about and think about. And I really appreciate Kate's comments on the conundrum of our particular board and where we have sway or don't, and what the sort of logical next steps are to take on something like this. But I do want to keep the conversation open and continue to stay very apprised of what's happening around us at the legislative level, or groups like the CU School of Public Health that talked to us today. And there are other really good people trying to do good work on this.
Okay. Any further discussion? Anna was waxing about whether she wanted to speak or not. The letter speaks for itself, is how I would summarize it.
Yeah, and Tom, there's other public comments on other meetings. Like I
Yeah.
don't think I don't want to feel like we're forcing someone to talk when they've
Oh, no,
obviously
no.
put a whole lot
No,
already out
I never
there.
want to do that either.
I can't, like, sometimes I think writing is easier than talking. So you know, I want to acknowledge that there are opportunities and to encourage people that want to talk to talk during public comment, and those people who want to write do this. So I appreciate the city for kind of forwarding this on to us so that we could, you know, talk about it. And I do think that we keep track of, I think, because if I think about other boards, right, like I think there is this sense of awareness, but then also like, well, what's happening? We can check in and see how things are going and ask questions about how the investigation's going for what they can tell us. Obviously, they can't tell us everything, but we can check in and see where it's going, and we can continue to have the conversation about you know, what we can do, you know, from a policy standpoint and from a recommendation standpoint. But I think that, you know, I appreciate, you know, the comment being shared. And yeah, I mean, I think putting it on as a topic for us to talk with Officer Gignac next week would be helpful to just understand maybe from an enforcement perspective how it's being responded to, just for our understanding of when we do get things like that, or when people do come forward to say that this happened, what steps are being taken.
Okay. Any other suggestions? Jacques, did you get a chance to talk to anybody else yet?
I'm not, no.
Not ready to rally the troops for other topics that you and I talked about?
Yeah,
okay.
we
Just wait. They can wonder what's that about. But they'll
I
find
mean,
out
yeah.
if you have one-on-ones with them. So
right. Got to schedule that with everybody. Have a cup of coffee. Get to meet.
Yeah. All right. Anything else, folks? Okay. So anybody want to make a motion to adjourn?
Ryan motions to adjourn.
A second.
Robin second, and all didn't note approval by saying aye.
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 Okay, ayes have it. Thanks, and thanks, staff.
Thank you,
Thank you,
staff.
everybody.
Thank you, board members.
Have a good
Thank you.
Steph.
Thanks all.
Take care.
Bye.